Good morning, my lovely nurses. I hope you are fine and your family is good. So today our lecture is hypocalcemia. Hypocalcemia. Hypocalcemia means the low calcium in our body. The normal calcium level is 9 to 10.5 milligram per dl. If the calcium is less than 9, we are telling this condition hypocalcemia. So hypocalcemia is a serum calcium level lower than 9 milligram per dl. What's the causes of hypocalcemia? The causes is the inhibition of calcium absorption from the gastrointestinal tract. Inhibition means inhibition of calcium absorption from the GI tract. From the GI tract mean our GI tract is not absorbing the calcium level. That condition also tell hypocalcemia. Inadequate oral intake of calcium. Inadequate intake of calcium. If the patient is not taking properly calcium, also can cause hypocalcemia. Lactose intolerance. Lactose intolerance. What is lactose intolerance? Is a sugar found in the dairy products. So our body is inability to digest lactose intolerance. So lactose intolerance is caused by a lessened ability or a complete inability to digest lactose. Is a lessened ability or complete inability to digest lactose, that is lactose intolerance. That condition also can cause hypocalcemia. Then the next is malabsorption syndrome. Malabsorption syndrome such as celiac, Sapru or celiac disease or Crohn's disease. So first we will talk about this celiac disease. In the celiac disease, the patient have impaired absorption of vitamin D. In the celiac disease, impaired absorption of vitamin D and the loss of calcium. In the celiac disease, patient have impaired absorption of vitamin D and loss of calcium. So that condition also can cause hypocalcemia. And in the Crohn's disease also is associated with hypocalcemia. Why? The poor calcium intake and decreased intestinal calcium absorption related to vitamin D deficiency. In the Crohn's disease also patient have vitamin D deficiency plus the loss of calcium. Due to this reason also can cause hypocalcemia. The next is inadequate intake of vitamin D. Intake of vitamin D. If patient is not taking properly the vitamin D, patient also have hypocalcemia. End stage kidney disease. End stage kidney disease also can cause hypocalcemia. So this all causes related to the inhibition of calcium absorption from the GI tract. This is all related to GI tract. Now the next cause is increased calcium excretion. The second main cause is increased calcium excretion. Mean the calcium is going out from the body. Excretion is out from the body. So which causes can be this create this problem, increase this calcium excretion. The number one is kidney disease. kidney disease, polyuric phase. Polyuric phase. In the polyuric phase of the kidney disease, patient have hypocalcemia, then diarrhea, then steatorrhea. What is steatorrhea? Is excess fat in the feces. Excess fat in the feces, that is steatorrhea. Wound drainage, especially GI, like NG tube, NG bag drainage. So this is the cause related to increased calcium excretion in the kidney disease, the polyuric phase, diarrhea, steatorrhea, wound drainage. This all related to the calcium is out from the body. That also all cause hypocalcemia. Number 3 main cause is condition that decrease ionized fraction of calcium. Ionized fraction of calcium. What is ionized fraction of calcium? Actually, about half of all the calcium in our blood. So ionized calcium refer to calcium in your blood that is not attached to the protein, mean free calcium in our body. We are also telling free calcium. The ionized, another name of ionized calcium is free calcium, because it's active and available for use. So which condition that decrease ionized fraction of calcium, in which conditions that decrease the ionized calcium in our body, that are hyperproteinemia. These conditions are decreases our ionized calcium in our body, because about half of the calcium in your blood is free calcium that is actively available for use. The rest of the calcium in our blood attached to the protein, mostly albumin, but the 50% of calcium is free calcium in our body. If these conditions we have, our calcium will decrease, the ionized calcium will be decreased in our body, and that problem will create hypocalcemia. So what is this? Hyperproteinemia, alkalosis, and acute pancreatitis. These problems decrease the ionized calcium in our body and cause the hypocalcemia. Then there is 2 more problems. Hyperphosphatemia. If in our body, this is opposite. If our body have increased phosphorus, 100% we have less calcium. So hyperphosphatemia also is the cause of hypocalcemia. And the last cause is removal of destruction of the parathyroid gland. If patient have removal of parathyroid gland, is the also cause hypocalcemia. So this all causes can decrease the ionized calcium in our body. Now assessment. How we will assess patient have hypocalcemia? So we will talk system by system. If we will talk about cardiovascular, in the cardiovascular, patient decrease heart rate. Number 2, hypotension. Number 3, diminished peripheral pulses. See, patient have hypo condition, so heart rate low, hypotension, and diminished peripheral pulses. This is the cardiovascular. If we will talk about respiratory system, in the respiratory system is not directly affected actually, but the respiratory failure or arrest can result from decreased respiratory movement because of muscle tetany and seizures. If patient have hypocalcemia, patient have tetany and the seizures. So due to seizures and tetany, patient can be go to the respiratory failure or arrest in case of hypocalcemia. If we will talk about neuromuscular, in the neuromuscular state, patient have anxiety, irritability, hyperactive deep tendon reflexes. In the hypocalcemia, patient have hyperactive. That's why patient have tetany and seizures. Hyperactive deep tendon reflexes. Then paresthesias. What is paresthesias? The numbness that affect the lips, nose and ears in addition to the limbs. There is a numbness, paresthesia, there is a numbness to the lips, nose and ears. And the most important related to neuromuscular, that is very important in the exam also can come, positive trocheo. So in the neuromuscular, positive trocheos, and Chopstick sign. So what is trocheos? Trocheos and chopstick. The trocheo sign is a carpal spasm. Trocheo sign is a carpal spasm. The how doctor will check? Inflating the blood pressure cuff and above the systolic pressure for a few minutes. So for the few minutes, doctor will above the systolic pressure for a few minutes and induced by inflating a blood pressure cuff. So what will happen? Patient hand will be do like this. This is the trocheus sign. If doctor will induce inflating a blood pressure cuff and above the systolic pressure for a few minutes, the patient hand will be like this, or you can see like this. This is the trocheus sign. And for the chopstick sign, is a contraction of facial muscles. How it will check? The light tap over the facial nerve. Doctor will do light tap over the facial nerve in front of the ear. Doctor will do a light tap over the facial nerve in front of the ear, and like this doctor will check the chopstick sign. See the chopstick sign, doctor will touch the facial nerve in front of the ear. When doctor will touch, the patient face will be like this. It means patient have positive chopstick sign and patient have hypocalcemia. And this is process sign. The doctor will put the blood pressure cuff, inflating for the few minutes the systolic. He will increase the systolic blood pressure for few minutes and patient hand will be like this. It means patient have positive trocheus sign. This is carpal spasm and it means the patient have hypocalcemia. Now if we will talk about the renal, how renal system will affect due to hypocalcemia, it's depend on the cause. So it's depend on the cause. Either patient have kidney failure or some related to laboratory test. So it's depend on the cause of the hypocalcemia. If we will talk about GI, the GI increase gastric motility, hyperactive bowel sounds. Hyperactive bowel sounds, cramping and diarrhea. Cramping and diarrhea. So due to diarrhea, patient have hypocalcemia, no, we read previously. So increase gastric motility, hyperactive bowel sounds, cramping and diarrhea. If we will talk about the lab values, which labs findings we have to see in the hypocalcemia, so serum calcium level less than 9 milligram per dl is hypocalcemia, and the most important ECG, what we will see in the ECG if patient have hypocalcemia, prolonged ST interval and prolonged QT interval. So in the hypocalcemia, prolonged ST interval and prolonged QT interval. Now what's the treatment? How we will intervene? Intervention. First of all, check the patient albumin level. If the patient albumin level has low, the albumin level if is low, always the calcium should be corrected. Calcium should be corrected if albumin level is low. Number 2, give calcium supplements orally. Calcium supplements orally or calcium IV. Very important, whenever we will give calcium intravenously, warm the injection solution. To body temperature before administration, and administer very slowly. Slowly administer the calcium and monitor for electrocardiographic changes. Whenever we will start the calcium, IV calcium to patient, always monitor ECG changes. Put on the patient on a cardiac monitor and check for the infiltration, the IV line. Always give calcium slowly and check the IV line for infiltration, and also monitor for hypercalcemia. We also check the calcium level for the hypercalcemia. The next is administer medication that increase calcium absorption. Administer medication that increase calcium absorption. So which medication increase the calcium absorption? As I told before, if patient have the phosphorus, if patient have increase, it means patient have hypocalcemia. So aluminium hydroxide reduce phosphorus level. So if phosphorus level will reduce, the calcium automatically will be increased. Is a counter effect to increase calcium level. Then vitamin D. Vitamin D aids in absorption of calcium. Vitamin D aids in calcium absorption. So these medication help for the absorption of the calcium. Provide quiet environment. Mean the less stimuli. Why? Because patient maybe have a risk of seizures. So we will, if always hypocalcemia patient have risk of seizures, so always initiate seizures precautions. Seizures precautions is very important. Move the client carefully and monitor for signs of pathological fractures, because patient have less calcium and less vitamin D. So always move the patient carefully. To avoid from the fracture. Keep 10% calcium gluconate. Always keep 10% calcium gluconate with the patient always in case of acute calcium deficit. And the last is always instruct the client to consume foods high in calcium. The foods high in calcium is very important. I hope you like the lecture. If you like, please share and subscribe my channel. And don't forget to push the icon bell button so you can receive my coming videos notification. Thank you very much. Take care of yourself and Allah Hafiz.